Hemorrhoids are incredibly common. Interestingly, hemorrhoids are part of the normal anatomy, but we use the term hemorrhoids if patient have symptoms. The symptoms patients may have are bleeding, itchiness, pain, or even prolapse. When I talk about prolapse, I mean that the hemorrhoid tissue itself externalizes, or the hemorrhoids protrude to the outside. So patients actually feel the hemorrhoids come out. Often patients even have to self or manually reduce the hemorrhoids. Hemorrhoids can be very uncomfortable, they're painful. People don't like talking about it, and they often put up with it for many months or even years before they seek help. And the important thing to know is hemorrhoids are very treatable. In the first instance, simple conservative measures are really critical. Avoiding constipation, keeping your fluids up, having a simple fibre supplement, simple ointments that we prescribe can help. With regards to treatment, there's an interesting treatment which involves an injection of almond oil. The blood vessels suck up the almond oil and it scars up the vessels to prevent bleeding in the future. But then often patients need a consideration for surgery, especially if they're treatment resistant. Surgery for hemorrhoids has come leaps and bounds over the last 10 years. There's been new advances technologically where we can offer surgery which is far less painful than hemorrhoids historically have been. Hemorrhoid banding is completed under a sedation anaesthetic, usually as a day surgery procedure, where a tiny rubber band is placed over the bleeding vessel and it prevents the hemorrhoids from bleeding, but also reduces the size of the hemorrhoids as there's less blood flow into the hemorrhoids. Sometimes patients need a more advanced procedure. During this procedure, while asleep and under anaesthetic, I utilise an ultrasound and individually find each vessel that's supplying the hemorrhoids and place a stitch in it, and that takes the oomph out of the hemorrhoids. The surgery is often day surgery, and we have a whole pathway that patients follow after they're discharged. I closely follow up patients at the first week and second week to make sure they're recovering well, and then usually we see an excellent result in 4 to 6 weeks. So it's important that if you're suffering from hemorrhoids that you seek review. There are other conditions that may mask as hemorrhoids, but that could represent something else. Fissures, fistulas, small growths within the bowel, or even tumours can present like hemorrhoids, and that's why it's important that you seek a specialist's advice to get the area assessed.